Hi everybody. So in today's routine, we are looking at postpartum recovery and what to do for the first several weeks postpartum. These are actually exercises that I continue to do myself as body check-ins. So no matter where you end up in your exercise routine, you can always come back to these as the building blocks for optimal breathing, core engagement, movement, mobility, stability in the body, and really like I use it as a body check-in. Where am I at in this moment? Am I breathing well? Do I have that hip mobility, stability that I need to say, go do a jog, walk, run, go do, my resistance training, things like that. So go ahead and follow this routine in your immediate postpartum recovery, but please do always come back to this as kind of your base layer for that deep core engagement in your body. In weeks 1 to 2 postpartum birth delivery, whether it was a vaginal birth delivery or a C-section birth delivery, these two very base layer exercises or practices, techniques are important for you to begin your recovery. I'm going to have you lay down as is comfortable. I always like to have some sort of cushion under my low back or entire back. Now, I know while I'm saying to lay down, I do know that postpartum, sometimes the sacrum, that top of the back side of the hips, can be very sensitive. So there are some other positions that you can do. You can always come into something like child's pose. You can do this seated. If you are going to do this seated, prop up on something to sit up on the hips a little bit more. And then in postpartum, this may not feel as comfortable, or just kind of try and like support the body here under the legs. Really, the point is to find the position that is most comfortable for you. That said, I'm going to go ahead and lay down, and I'm going to try and cue some breathing. And really, what I'd like you to do with this breathing is not focus so much on the up movement of the belly, but the entire movement around the body and gentle pelvic floor activation. You can rest the hands on the belly, over the ribs, or just on the side. Alternatively, you can bring something and just lay it on top of the belly for some input. As you inhale and exhale, take a moment to let your body breathe. Think of this as the natural breath. And as I breathe, you will see the block move. Please know I'm not specifically breathing up into my belly. This is the natural movement of the body. And as you are here, you may have, so my tummy just growled, and so as you actually begin to relax, the body's systems begin to just kind of let go. The gut system, the enteric system, is one of them. And so when you do find that kind of lay down, relax, let down, the body may respond. It may not. So we're always doing this without judgment, without expectation, without competition for anything, right? We're just trying to be in the present moment. You can do this style of breathing immediately in the hospital after you've had a few, couple of hours of rest after birth delivery. To connect the pelvic floor, I want you to think about everything that sits between the sit bones, underneath the hips. You can even put your hands underneath your hips or around the backside. And with a more intentional breath, lengthen the inhale and the exhale to about 4 counts. You can exhale out of the mouth or the nose, but please inhale through the nose. And to whatever extent you can in this moment, feel the breath not only in the front, but kind of expand along the back of the body and the pelvic floor. So on the inhale, there's no nudge, no intention of pushing the pelvic floor down, no need for that. That's already happened, especially in birth delivery, but just let that space open or relax. And as you exhale, kind of feel the breath come back out of the body in an upward movement. I always like the idea or image of an ocean wave, just kind of rolling in and out. And that's how I see the breath. It doesn't matter which, part of the ocean wave matches up with the breath, whether it's coming to shore or going out, that's the inhale or exhale, but just feel that gentle movement along across the body. The inhale moves down the body, the pelvic floor gently lets go of tension, everything between the sit bones. And as you exhale, the pelvic floor, the breath, the diaphragm, everything returns to neutral. A couple of days after birth delivery, once you're home, you can begin to do some pelvic tilts with this breath style. And I am going to recommend that actually the focus is more on bringing the tailbone towards the body on the exhale and inhaling, and just let the body be. The body is used to going in the opposite direction because of pregnancy. And so while this may feel great, the movement we want to emphasize is actually this exhale and drawing kind of this tuck type of pelvic tilt. Inhale, let go. Same inhale breath and exhale. Inhale and exhale. These two practices, both the breath and the pelvic tilt or tuck movement with the breath, are what you'll use for your initial postpartum recovery. And then once you become a little bit more comfortable with breathing and movement and you feel a little bit more rested, go ahead and start walking. Walk 10 minutes, or move around your house as much as possible. Within these first 2 weeks of postpartum recovery, this is your chance to reconnect to your body. So this next series or 3 exercises that we'll be doing is for postpartum weeks 3 to 4. You can continue to do what we went over together from weeks 1 to 2 in the previous video. Always worth it to reconnect to your breath, and always worth it to do some pelvic tilts. But I'm actually going to show a couple of different or just progressions of those. If you want for laying down, if that sacral area again is really uncomfortable laying flat, find some cushions. Also, one thing you could do is just prop up. I find that sometimes putting just the like kind of back of the hips on something like this helps to level out the torso and the low back so that there's not so much pull on the sacrum or pressure on the sacrum. When we take the blanket away, what happens is there's actually this arch that our spine just kind of in the low back curve tends to land all that pressure down on the tailbone. So any little lift just under the back of the pelvis to the low back, kind of right where the mid back starts, is where you would stop the blanket. And that just settles everything out enough to let the back rest down and take pressure off the sacrum. So that said, here we are going to lay down and again, find the core breath that connects between the diaphragm and the pelvic floor. And that is where the inhale comes down into the body. Everything kind of moves downwards. And as you exhale, everything moves upwards and out. Always inhale through the nose. It's just the best, most optimal way to breathe in. The exhale, for different purposes, can be done through the mouth or through the nose. We're going to add a bridge lift today. So bridge is where both feet are on the ground, knees are bent about hip width apart for the hips and legs. Hands can be resting wherever is comfortable. You'll exhale, Get all your air out. Inhale, lengthen through the body, all the way through the pelvic floor. Exhale, press to the feet and lift the hips off of the ground to any height that is comfortable. Maybe this movement feels a little bit unstable or kind of wobbly. That is okay. Inhale to set the hips down. We're just getting used to moving again. Postpartum, right? No weight up front here in baby belly anymore, but we certainly don't have the activation we used to previously prior to pregnancy. Inhale. Exhale, always to lift. Inhale, return down. And again, exhale to lift. Inhale. I really like to cue, press through the whole feet, right? The sole of the foot, so that there's not toe gripping or weight just on the heels. The whole foot is contacting the ground and the arches are active. The minute you just almost like press into the foot, everything in the back chain begins to activate, which is what we want to do for our glutes as well. Very important. We're going to add a component to that pelvic tilt that we did last week with a little bit of a ball squeeze. And so you can use a yoga block, you can use a blanket, a yoga mat, a pillow, anything here if you do not have some sort of core ball, Pilates ball type of setup. And in a similar position, this is hook lying or kind of neutral psoas rest pose, neutral resting pose. You're going to squeeze the ball on your exhale and tilt, or actually tuck the pelvis this way towards the body. Inhale, just release, because remember, even from that first video, the release is automatically going to kind of put the body back into the natural curve of the spine. We don't really need to go much further at this point. We're not back bending because we've already been during pregnancy in that bigger curved back posture. Again, on your next exhale, squeeze the ball gently and just draw the tailbone towards the body. Inhale, release. And exhale, squeeze. For each of these, the bridge and the pelvic tilts, anywhere between 5 to 8 repetitions. You can do this daily. Be gentle, listen to the body, and remember, it's not competition. We are in the 3 to 4 weeks postpartum at this point. These are exercises, again, that you can carry on with you as you increase your exercise activity. They are always great base layer practices to do to get the deeper core muscles working together. Another fantastic way to end your day or to provide the body some rest is legs up the wall. And that can be any version of legs up the wall. Again, bring that blanket with you. You can prop the legs up the wall. You can prop the legs over a couch, over a chair. In weeks 3 to 4 postpartum, I'm going to recommend just provide some space. You don't have to get the legs straight up the wall. So if you've done this, say in an exercise class or in a yoga class, you do know that often the backside does touch the wall. But that deeper core isn't quite ready to do all the maneuvering and scooting around to the wall. And so really the point here is to provide just a reverse gravity kind of pull on the body, and the connective tissues allow the pelvic floor, in this case, just to rest, right? So we kind of flipped ourselves upside down and everything is just kind of sinking back to the body. It feels pretty good. It relieves pressure so that if after a long day of holding, babysitting, nursing, feeding, chores, all these things that are back in the life that you return to after being home for a couple of weeks, maybe the pelvic floor feels like there's pressure or heaviness. This is the best way to relieve that pressure and heaviness. But also you can just put something over your eyes, let the arms relax, and take a moment just to breathe easy. In this instance, let the body breathe on its own without telling it what to do. And enjoy this space. Weeks 5 to 6 postpartum, we start to build up a little bit more strength in the core. And so we're going to do some hands and knees work just to begin to activate the core against gravity. So the first two videos, weeks 1 to 2 and weeks 3 to 4, we activated the core with gravity, which basically means we were laying down and to kind of draw in and with the breath and tilt and tuck. We weren't really working, we were kind of letting gravity help us as well. When we're working kind of all fours, hands and knees, things like that, we're now having to stabilize our core off of gravity. So here we go. The first movement that I love is on the forearms, placed down on the ground, and hopefully it looks like in the video, but my knees are under my hips roughly, my elbows are under my shoulders, and instead of kind of dumping into the low back, I've lifted through the spine so that I feel pretty lengthened. It's kind of like almost a neutral slight round. So rather than neutral or kind of curve in that lower back, neutral slight round. And what you'll do, and I'm hoping here, I'm gonna tuck my shirt in just a little bit so you can see this low belly area. Exhale, get all the air out. You're gonna inhale, and on your next exhale, you're gonna use a pursed lip breath and blow all your air out, like really, until the very last bit. And you're gonna let the breath guide any activation that's happening in the core. So don't let your mind say squeeze the tummy. Just let your breath do the work. It's gonna look like this. So watch here. On my inhale, I also like to breathe into my back. So I know the belly breathes, it opens and expands, but also think about breathing along the back of the body too. One more time, just like that. So belly has expanded. This is a great breath practice. It is engaging what is called the transverse abdominis. That is a very deep core muscle that helps just keep everything moving with the breath in the way it should, like inhaling, expanding, exhaling, drawing in. So not to get too complicated into anatomy, but if we grip into our stomach a lot, we're using more of the superficial muscles, we're not activating the deep core. So that is why the cue that I gave said, let the breath do the movement. Don't let the mind do it. I would do that particular activity or practice 3 breaths in a row. I love this one to set up the day. So oftentimes I will just do this against a counter. I don't have to get down on the ground. So I'll put my forearms on the counter, say before I brush my teeth in the morning, and just get all the air out just blow your air out, inhale, start the practice, and then really do with a pursed lip. Practice really lengthening the exhale, and that's going to help tap into that deeper inner layer core for support. So after that, then let's come into some cat-cow. So here we're going to bring in a little bit of a back bend, but I do want to still emphasize this kind of tailbone tucking, rounding on the exhale. Inhale, return to neutral, and if it feels good, do a little bit of a back bend, but honestly, I would like to see more lift out of the heart center and kind of a lift from the back of the head. Notice I'm not lifting my chin straight up. I'm actually lifting my head from the back crown center for strength and length along the spine. And that's very important. We want to begin to activate this kind of back upper chain here between the shoulders up into the crown, back of the head. That's your inhale. Exhale. Kind of round as much as you can. This may still feel a little disjointed or uncoordinated, but just try to draw the tailbone towards the midline or center of the body. Inhale. Lift more from the heart and the back of the head. You can let the hips go too, but gently. And exhale. You can repeat that as many times as feels good. So if that's part of a morning routine or a practice before you go for a walk, if you still are incorporating, say, the bridge and breath lift for glute activation and maybe a pelvic tuck tilt or maybe the ball squeeze between the legs and pelvic tilt, these are excellent continuing exercises or practices to do. Again, you can always combine all of these together as you are coming towards like almost 8 weeks postpartum. So this is 5 to 6. We'll do another video for 7 to 8. So you can make this your own routine as well. I am going to add in clamshells. And so clamshells can be done, there's fire hydrants in all fours, but we just did 2 all fours exercises. So I'd rather lay us down on our side just to give the core a break, because if we stay too long in forearms and the core is not strong enough, you're gonna start to like dump into the low back again, and then we just lose the efficiency of the movement or exercise. And so for a clamshell, you want to line the body up, find something for under your head so that it's kind of head to midline, and you're going to bring the knees towards the body but the heels in line with the hips, and so it's kind of like a sideline position. I like to keep my hand either over the ribs in a kind of C-cupped position or down on the ground. And then I'm going to cue that the bottom leg stays anchored to the ground. Blow all the air out. Inhale. Exhale, glue your feet together and lift the knee. Inhale, lower the leg. And I'm using my hand here to kind of cue my breath in the round. So I'm breathing not just in one part, but I'm kind of breathing into my hand and into the ground. And notice that as I anchor the bottom leg to the ground, there's only so high that the top leg can go. If it goes a lot higher, we actually lose, again, the efficacy of the practice. And so you're only going as much as you can really get that hip up while still grounding into the floor. Inhale, lower down. I'm hoping we'll feel this along the outside of the buttocks. And so really it's glute medius side muscles that we're working here. If you begin to feel it in the back, there is some crunching or lifting or rotating happening. And so just, reset, lengthen, and see where you can kind of position yourself to feel it mostly in this side hip. You'll feel it in some of this bottom leg too. Again, 5 to 8 times, and then roll over and switch to the other side. We will also do, I've got the Pilates ball here, a reverse clamshell. And so you can either use the ball or you can do the knees as well. I just often like the little ball squeeze gives a little bit of proprioceptive input for me. So same concept, only now we're gonna glue the knees together and we're gonna lift the foot up. And the hand can be placed here. Again, the inhale is the lower down. The exhale is always going to be the movement or effort. So blow all the air out. And I say that just to get the breath back in a more efficient way. Inhale. Exhale, lift from the foot. Inhale, lower. So I'll show with the ball a few times. Exhale. Inhale, lower. You're also going to knock the knees together. If you don't have a Pilates ball, a blanket, a pillow, a block, a mat, or just the knees is good. Again, you're anchoring this bottom leg to the ground, and as you lift the heel, you're still going to feel the movement somewhere along the side glute, but now a little bit lower too, possibly around the sit bones. And this is just a great internal rotation move to help for hip stability. Try these, include them into any of the other movements, practices that you've been doing, or just you can separate them out and say, I'm just going to do these for weeks 5 to 6 and continue to breathe. Weeks 7 to 8. So about 2 months postpartum. Let me say something really quickly here is that for every month pregnant, go ahead and just set the idea in your mind that it's going to take about 2 months per month pregnant to recover. So that puts postpartum recovery out to about 18 months. You may recover more quickly, you may recover more slowly. It just depends on lifestyle, the time you have, as well as just, what's going on in your life at the moment. So always use grace with yourself and be like, this is healing. And you really do want to address some of these base layer practices so that in a few weeks or a month or so, when you're ready to get back to more active movement, exercise, or daily things that you do, you feel really set up to do so. We're going to start standing today, and we're going to start with a calf raise. I like, single calf raises are great, or heel lifts, heel raises. So just find a wall. And the reason is because we want to start to now activate our pelvic floor from the floor. So it's called floor to core connection. And a lot of times in pregnancy, we've lost a lot of glute muscle, which means we probably actually are like flat-footed a little bit more. We had some feet spread happening during pregnancy. We want to begin to activate from the arches of the foot, which really sends this activation line up into the pelvic floor. And so calf raises or heel raises are a great way to do this. And honestly, it's just, find a wall and up and down. And just try to articulate through the whole foot. And what that means is you're not bouncing around, and just try to get the, heel lift off the whole way. You can do as many as, up to 12. I would always start with 5 to 8 as the body is beginning to recover. That's a lower number than what is, seen typically when we are doing resistance training, or depending on what kind of resistance training you're doing. But I like that lower number just to get the body back, right, without pressure. But just do as many of those as is comfortable. You can repeat on the other leg. And then of course I do like a calf stretch right after that. Just fold up a blanket or some sort of prop that feels like you can get the heel to the ground and you can lift the ball of the foot up and over. Stepping forward adds a little extra stretch to this, and it just feels nice. And go ahead and do for both legs. And then the other standing exercise movement that we're going to do are squats. Squats are not as deep as you think they have to be. And I really do want you to think about like it's a chair. So think of the sit bones under the hips. I often like to say, the sit bones are right up and under the butt crease, or the butt cheek crease, or underbelly line, just depending. So when you are coming into squat, rather than thinking about hips back or tailbone back, I want you to think about sitting the sit bones down to a chair behind us. And that will just help keep the low back more intact. Y'all are ready for this at 7 to 8 weeks postpartum. You've probably already been squatting because you've had to do lots of different things in the house. And with baby, right? Squat to pick up car seat, things like that. So just let's work on form and breath. As you find your posture, remember it's head over heart, over hips, over heels is how I like to cue a starting posture. So find that. Feet are about your hip width apart, which means find that front pointy bone on the hips. And that's about where your toes line up with. So it's not hip width out here, nor is it hip width narrow. So just find that hip width stance. And then keep the toes for now pretty much in line with the knees. My toes end up pretty forward. If your knees have a slight turnout, that's okay. If there's a slight turn in, that's okay. But not to like really big degrees, right? So just kind of keep them as much forward as possible. The outer edges of the feet is a nice way to look too, that they kind of point forward, the outer edges of the feet. As you sit down, you'll inhale. And as you stand back up, you'll exhale. Think about the whole foot. And yes, when you come down, there's a little bit more weight in the heels, but think about the whole foot taking the weight. And as you exhale, press back up as much as you can through the whole foot. From the side, and again, hoping there's not too much of a low back swing. So sit from the sit bones. Inhale, exhale. Inhale, exhale. There's a little bit of forward hinging for sure, and that's okay. Again, start with 5, work your way up. These are great to do daily. If you want to practice with a chair, find a chair that is high enough that you feel like you could kind of brush it or touch with the sit bones so that you get the idea of how far down and up. Again, a squat does not have to be a huge knee bend. It doesn't have to be super deep to be effective. We are strengthening the back line of the body. The last one for postpartum weeks 7 to 8 is again all fours, working against gravity. And now again, last week, or the last 2 weeks, we were working on cat and cow to kind of strengthen and begin that back chain activation. Now we're gonna do an opposite arm and leg balance. Sometimes I think I've heard it referred to as bird dog. You know, it's a very common pose used in exercise classes, Pilates, and yoga. Set yourself up. I always like cushion under the knees. If the wrists are, if you are in that stage where you're like, I am experiencing carpal tunnel like never before, just because of holding baby and things like that and hormones, find another blanket or towel. And what you would do is put the heel of the hand over the lip of the towel, so that decreases the angle at which your hands have to bend or your wrists have to bend. And then come to that, what I called neutral slight round. So again, take the big curve out of the back, right? Just for the moment. And what you're gonna do is actually start, the breath is gonna help you here, but just breathe. There's no real pattern for your breath here. You're gonna bring one foot behind you, just slide it on whatever surface you're on, because that's gonna help keep the hips as level as possible. A lot of times, people love this practice, but what happens is they lift the leg and they twist and turn the hips and they arch the backs, and that's not quite what we're going for here. We are going for activation of the back chain, especially along the multifidus or the multifidi. These are very important for the deep core activation chain. So again, slide the foot behind you, that's gonna reach behind you, and that should automatically begin to activate posterior, right? Through the glute, medial glutes, and definitely through the back of the body. Now, stay here and practice this for a while. This is like part one of this movement. You can certainly lift the leg, but try where you just unweight so the toes just brush off the mat. Because again, we're really trying to keep the hips level. If it's like you're here and you want to lift up and you twist, then we've lost the activation that we're going for. In similar practice, you can keep the foot down or lighten the weight in the toes, and then take the opposite arm and just brush the hands forward. So again, you're not twisting or doing something funny with the shoulder, you're just staying in line. This is pretty effortful right here. You can pick the foot up and hand up and lower down, and come back and switch sides. Sliding the foot back, staying here, practicing this, you know, maybe a day or two. You can add in that hand slide forward if you want to try first picking up the leg. Various progressions for this particular practice. You can hold, and you're never really going to bring the leg much higher than hip height. You can either point with the toes or press through the heel. I do kind of like to say, I like to always be able to see my big toe. So I kind of press through my heel, look down, see the big toe, and that helps me line my body up and rest. That's a really big back chain body activation. So again, progress it so that you feel successful and that you're able to feel really successful in deep core activation. I always love ending any of this with the legs up the wall practice that we did. So just to repeat, you can bring in any of the things that we've done in the previous videos. Just because they were specific for postpartum weeks doesn't mean you can't continue to do them. It was just that progression is really what matched what the core was ready to do in those weeks. But they are always great base layer practices to set the body up for success, to activate the deep core and get you on your way in your postpartum recovery.